Okay, let's talk about Chapter 3, Disease and Treatment. Um, this introduction's in your book. I'm not going to read it to you. We'll go to the next page. So, types of diseases. Disease is basically any kind of malfunction or disorder or disarray of a normal bodily function. They're grouped into different categories, and you can read about those here. The book does a great job. Your PowerPoint's full of information also. Infectious diseases, these have definitely been a hot topic here in the past 5 years. You can read all about infectious diseases and how they name them, why they name them certain things. For example, one of the things mentioned in the chapter is um, here we go, focus on the words. So, like where the diseases get their names in a variety of ways, where they come from, who invented, or not who invented it, who identified the disease. So, for example, West Nile disease, that came from, like the West Nile River area. There's nothing wrong with naming them these type of things. Rift Valley fever. There is actually a syndrome here in North Carolina near Greensboro. Oh, and I can't, Hall River. There's a Hall River syndrome. And so, there's nothing wrong with naming a disease or disorder from the locale, from where it originated from. Um, so, yeah, I'll just end it with that. And also, the book goes to tell you, like Crohn's disease, for example, the doctor who discovered that, or the researcher who discovered that, his name, was Crohn, and Hodgkin's disease, etc. It has to do with who first described them, who first found them, etc. So that's where some of the names come from. This goes into EMTs. This little box is fabulous for your reference. Type of organism, and it gives you how to say it. So bacteria, cocci, bacillia, or see, I added an A, so that's bacilli, fibrosis. You can continue to read them, but the book does a great job with that. Responses to disease. So inflammation is an automatic response to something wrong with the body. If you've ever had a mosquito bite, if you have ever accidentally slammed a hand or a finger with a hammer, car door, anything traumatic like that, instantly it swells. The ankle is the worst for swelling, and it takes so long for an ankle to recover from inflammation. The book then goes into some of the cellular level things that happen when there is disease or infection that enters into our body. Our blood systems automatically go into phagocytosis to get rid of the invading microorganisms, damaged cells, etc. This happens at an infection or at a level of like a scrape on your knee or an arm, or it can even be as wide as like cancer. Your body is designed to fight cancer cells. Sometimes when we have a cyst that shows up that ends up just being a benign cyst, that was probably your body responding to something foreign, something it didn't like, infectious, cancerous. Your body went through this process, and that the cyst is what's left over from your body, ridding it of that microorganism or what have you. We develop immunity when we are exposed to infectious disease. Ooh, that's been a hot topic the past 5 years also. The book does a great job giving you a visual and explaining that. Neoplasia, oh, so this is what I'm referring to is uncontrolled growth of a tissue, whether it is a cancerous tumor, non-cancerous. There are both. You can have benign or malignant tumors and cancer cells that can metastasize, or they may just stay right where they are. The book discusses carcinoma, sarcomas, often mistaken for a malignancy. Here is a cyst. That's what I was just referring to. Terminology, more key terms. I don't expect you to have every one of these memorized, but you're welcome to do that if you are heading into a career, or even if you're currently working somewhere where this is beneficial for you. If you want to memorize these terms that are in these chapters, go for it. There's nothing wrong with learning this language and having it as kind of like a second language, and moving forward in any healthcare career. I'm not going to require it of you, but you're certainly welcome to utilize it in that manner. Flashcards are a really good thing to learn new vocabulary. what is this showing me? Figure this. So this is just an example of a hernia and how a hernia occurs. The stomach actually pushes through the diaphragm wall, and there's the esophagus. So this, your food comes down, and then if you have a hernia, the food kind of hangs out here. This is what actually people can sometimes have a hiatal hernia, and it gives them reflux. For some reason, somebody suddenly has reflux. You may have accidentally protruded your stomach through your diaphragm wall. Oh, and there's so many ways you can do that. There's so many reasons that happens. That could be a whole nother lecture. Word parts pertaining to disease. This is a great table in your book. The root word, the meaning, an example of how it's used, and the definitions listed there. Again, these exercises, you are welcome to do these because the answers are right in the back of the book in Appendix 11, so you can test your own knowledge as you go through the chapter. Prefixes, so above there was the root word for diseases. Your prefixes are listed also, another exercise, and then there's your suffixes. So you are welcome to pair these words together how you wish and complete words for diseases used as suffixes. Okay. Da-da-da. Normal lid, drooping lid. Ptosis is drooping of the lid. Another exercise. I feel like this is just going forever here. Prefixes and roots for infectious diseases. Yes, so streptobacillus, um, bacterium, bacteriostatic, mycotic. Okay. Oh, more terminology. Yeah, I mean, this is a medical terminology course, so tons of terminology throughout this chapter. My assessments that I'm going to provide you are going to be kind of high level. Like, I just want to make sure you grasped the basics of this chapter. You're more than welcome to ask me any questions as you go through term abbreviations. So I am not focusing on abbreviations so much because abbreviations and symbols are very site specific depending on where you work. Again, you're welcome to learn these if you choose to, but FUO, that is not an approved abbreviation where I work. We would not be able to write this out or type this out. You would have to write out the entire. So that's why I'm not really focusing on the symbols and abbreviations. Okay, diagnosis, a medical diagnosis, it can only be provided by a nurse practitioner, physician assistant, medical doctor, or surgeon. You cannot get a medical diagnosis from your neighbor, from the internet, from a registered nurse. It has to be an advanced practice nurse, like a nurse practitioner. Um, Medical diagnoses, people go to school and there's a lot of training and a lot of information that goes into the ability to make a medical diagnosis. They have to do a visual examination, palpation, percussion, auscultation is even sometimes required to make a medical diagnosis. And honestly, we can't diagnose everything just by, a human being. You really have to use technology, whether it is X-rays, scans, blood work. I think the chapter goes on to talk about that too. Yes, vital signs are mentioned. If you've ever been to the doctor, one of the first things that med tech will do is to take your vital signs. An otoscope, ophthalmoscope, I think. Yes. So this one looks in your eyes. If you go for your annual eye exam, I'm sure you've seen your doctor use this. And this is otoscope to look inside the ears to look for normal. Ooh, a bronchoscope. So this is always interesting. This is usually done in an outpatient setting, not usually at a doctor's office, unless they have like a bronch suite that they could do it in. But it's pretty cool, and you're definitely want to be sedated for this. You do not want to be awake for that. I'm sorry, I'm getting sidetracked by the visual. The bronchoscope can actually go inside the lung material itself, go deep down into your lungs and take pictures, take samples, do a biopsy if you need to. So here's the imaging techniques for diagnoses. Again, sometimes you can look at something with your eye as a doctor, provider, nurse practitioner, and you can diagnose it, but other times you've really got to use some imaging techniques. And so the book does go into that. Treatment can be very different for everybody. You should never, this is my opinion, but more studies are coming out. We should never treat 10 people the same way with the same diagnosis. You could offer similar treatment, but you really need to make your treatment very specific. Okay. Treatment can be therapy, it can be medication, it could be alternative meds, it could be vitamins, it could be stretching, exercising. There's so many things. It could be surgery. How you treat a disease depends on the disease, and the provider and the patient should always come to an agreement about what their own treatment should be. Here's some more terminology for you for your reference. Surgical instruments. Mm, Many types of operations are performed with lasers and cauteries. Absolutely, they are. Some things for treatment of disease, you have to remove an item, and that's so this section of the chapter is talking about that. Alternative and complementary medicine. Lots of terminology involved in these things. I will say traditionally, I can speak to the past 100 years, our Western medicine and our complementary medicine do not mix well. They kind of avoid each other, and that's not okay because in today's world we have access very quickly to alternative complementary medicines and Western medicines. So we need to let our doctors know what we're taking that might be homeopathic or more natural, because some homeopathic herbs, leaves, trees, plants, roots will counteract with um, prescribed medication from a pharmacy. That's what I'm trying to say. So just be aware of that. Don't discount the alternative and complementary medicine options that are out there. Some of them really do work. But again, the provider, nurse practitioner, doctor has to really come into an agreement with the patient. The patient gets to ultimately decide how they treat their diseases. So here's a page all about cancer. The terminology is, oh, some of this we've already talked about. So this table has come after the sections that I just went through. Word parts, here we go. Here's some more root words. We got suffixes for the surgery terminology. If you have any questions about these terms, let me know. You can always, again, I say practice saying them out loud. Here's another symbols terminology. I am just not really hyper focused on these because not all of these are allowed in medical settings. It's specific to each medical setting. And also, here's one. I mean, I might would, if I ever were to test or question you, like HMP, what does that mean? Because that is an approved abbreviation pretty much throughout. But let's just focus on the terminology for now, the meaning of the words instead of abbreviations and symbols. Drugs. So medications are a way to use substances to treat different diseases and things that need to be corrected. There are such things. There's no drug on the market today, even good old Tylenol and penicillin that's been around 100 years. Um, there are still adverse side effects to those medications. There's always a potential for a negative side effect to any medication or any substance you put in your body, no matter what drugs we're talking about, whether we're talking about prescribed drugs or illicit drugs. There's always a potential for a drug adverse reaction. Um, Drug names, drug information that's listed here. Herbal medicine, so this is kind of going back to that complementary and alternative medication. Be familiar with some of this stuff. Anaphylaxis, antagonist, brand name, contraindication. So contraindication is what I was talking about a while ago. If someone is taking herbal and root therapy and the doctor goes to put them on a medication like Coumadin or maybe albuterol, those can interact. So it's very important for the doctor, provider, nurse practitioner to know exactly what the person's taken. That's why every time we go inside of a healthcare facility, they are adamant about we list out every single thing we're taking because we want to make sure that we're not going to prescribe something that interacts. Drug administration, medications can be entered in the body in various ways. Oral, you can even inhale. Here's a great picture of an inhalation. That also goes for smoking and vaping. Eye drops, there's injectables. The injectables also happen at different levels. It can be straight into the skin, it could be into a muscle, intravenous. Some medications, we actually do want it just to stay on the top layer of the skin, and that's where the medication works the best. Drug preparations, this is just for your preference, for your reference. This information, this terminology would come in very handy if you're going to be a pharmacy tech or go to pharmacy school. And same thing here. All right, so let's see what this next page. Oh, we got more word parts.